Hello, the topic today we are going to see is about gastric cancer or stomach cancer. So we all know stomach is an organ from the food pipe, the stomach, then small intestine. It's a bag-like structure mainly for digestion. It has other functions also, but mainly for the digestion. Okay, gastric cancer or the stomach cancer is a very broad word below which there are so many other cancers out there, but generally we call that gastric cancer or stomach cancer. Okay. The cancer, there are different types of cancer. That's all depends upon from where it's arising. See, stomach is made up of actually 5 parts: cardia, fundus, body, pylorus, antrum. So these are 5 types of parts in the stomach. And also it's a bag-like structure, and each wall of the stomach has 5 layers. In fact, innermost layer is called mucosa, then submucosa, muscular layer, then subserosa and serosa. So from the origin of the cell, there are different types of cancers are happening. So 70% of the cancers are adenocarcinoma. They are nothing but from the inner layer of the stomach, the columnar cells, they give rise to the cancer. It's called adenocarcinoma. Apart from that, there are other cancers like GIST, that's gastrointestinal stromal tumors, neuroendocrine tumors are there, lymphomas are there, and leiomyosarcomas are there. These are depends upon the type and cell of origin. So stomach cancer is a very broad term, and below that there are so many other cancers are there. Okay, who will get cancer? The first thing we always say is those who have a risk factor. Say somebody may have the risk factor. If suppose somebody has a risk factor, that doesn't mean he will get cancer. It's only a risk factor that shows he is prone for stomach cancer. Okay, what are the risk factors? Usually the risk factors are broadly classified into modifiable and unmodifiable. So the modifiable is the one which is we can modify, we can do some prevention. Unmodifiable factors we cannot do anything at all. So the best example is the age. This is an unmodifiable factor where suppose somebody is more than after 60 years, the chance of gastric cancer is very high. Then sex, male sex. If a male comparatively have a little high risk of getting stomach cancer. Then ethnicity. So people from their country, religion, these matters little bit. Especially if you can say, Africans and South Asians are more prone for stomach cancer. These are all, we cannot do anything about all those things. This is like a fixed risk factors. Okay. Other factors, what are the factors? The first and foremost we say is always the diet part. The diet is like, suppose their regular diet is like, preserved or stored food. Those who take a lot of preserved or stored food, the chance of stomach cancer, the risk is very high. And salted or pickled vegetables or pickled even meat, all these things have a lot of salt. So this increases the risk factor. And not only that, the diet which has high fat content, or if you use repeatedly, the cooking oil is repeatedly used. So these are can cause the risk factor for the stomach cancer. Even dry fish, which is high salt and the stored one, so they have a chances of risk of stomach cancer is very high. Then next is smoking and alcohol. Everybody knows smoking and alcohol definitely increases the chance, not only the stomach cancer, all other cancers also has a chance, risk factor for the alcohol and smoking. If both are there, the risk factor at least triples. Okay. Then come to the pathological part. Okay, we can say first and foremost we can say H. pylori infection. Helicobacter pylori is a very common cell in the pylorus of the stomach. Every normal human being will have that organism. If that goes beyond certain level and causes atrophic gastritis. What is atrophic gastritis? The stomach inner lining has a lot of rugosity, ups and downs. Because of the infection, if the rugosity of the ups and downs becomes flat, that's called atrophic gastritis, which can lead to, which acts as a risk factor for the stomach cancer. Okay. Next is pernicious anemia. The same thing, like you need intrinsic factor from the stomach to absorb vitamin B12. If the B12 deficiency is there, that can lead to atrophic gastritis. This atrophic gastritis causes inflammation and can cause cancer. It acts as a risk factor for the cancer. Then family history. Of course, like any other cancer, family history is very important. Suppose father, mother, or if they are at the younger age, or siblings, if they have a stomach cancer, the risk factor increases. Then occupation, definitely. Stomach cancer, the risk factor is high. Those who are working in coal field or maybe a chemical industry or even rubber industry, these are very common for the stomach cancer. And interestingly, we can say those who have a blood group A, blood group, they have comparatively have a little higher risk to the general other blood group people for the stomach cancer. Apart from that, there are certain we can say inherited cancer syndrome like things like Meniere's disease or Lynch syndrome. All these things, which we can't do anything about that. These are all in the gene part. It's given to the next generation like a hereditary. So these are the risk factors for the stomach cancer. Again, and I want to tell you, just because of you have a risk factor, that doesn't mean you will get a cancer, but the chances are high. Those people with one single factor may get cancer, people with multiple factors may not get the cancer, but the chances are high if you have a risk factor. Okay, once the stomach cancer has come, okay, how it will present, or what are the signs and symptoms it can give you? The first and foremost, I always say, is loss of weight without any effort, and without your knowledge or without any unintentional weight loss. That is the first and foremost. The second thing is loss of appetite. See, the loss of appetite may have so many reasons, but weight loss with loss of appetite and some pain or discomfort or even yearly fullness. So they will have a small food, but the stomach feels full and heavy. So these are the three things, and especially if they are around 40 years, this makes, we have to look into little seriously. It will not lead showing it's a cancer, but we have to look. So weight loss, loss of appetite with small food, heaviness, fullness kind of thing. Apart from that, it can give you indigestion, heartburn. Suppose the tumor or the cancer is the junction of food pipe and stomach, difficulty in swallowing, the food may not go easily, or even you can throw it up. Or suppose the cancer is in the last part, pylorus of the stomach, you can go for gastric outer obstruction and causes vomiting. And again, suppose it's a tumor, it's like a wound. Suppose suppose we have a wound here, you can smell, the same way. Suppose you have a wound inside, cancer kind of thing, you can have a bad smell, nausea, vomiting. In fact, sometimes the cancer cells can bleed, so they may have a blood vomiting or black color motion, they are called melena. So these are the signs. And of course, suppose the food is not absorbed and there is a bleeding, so they can present with anemia. Most of the people, that's why we always say, people around 40 years don't take anemia very easily. Always look what could be the reason. So anemia, they can present as anemia. And even sometimes they come to us with a jaundice, and we evaluate, we may find a cancer in the stomach. So these are the main signs and symptoms of cancer stomach. Okay, how to diagnose next? Of course, the first and foremost is clinical examination, history and clinical examination for the clinician. So you will examine the abdomen, any mass, any in the hearts, pain. They look for lymph nodes. All these things is very important, and then you will ask for some battery of tests. They write from anemia, jaundice, liver function. They will ask for it. And the first and foremost, or even the gold standard, is always the upper GI endoscopy. So the upper GI endoscopy, food pipe, stomach and small intestine, we can see, and if we see something abnormal, we can take a biopsy, or if there is a bleeding, you can stop the bleeding, and the biopsy is sent for the test, and it will give you what is the type of cancer and what is the type of cancer. So this is very important. Then apart from that, Even the clinician may ask for CT scan, PET scan. These are all for whether the tumor is limited only to the stomach or it's spread to the other areas, or even staging is gone to the lungs or bone or anywhere. So this for staging workup, these can be done. Okay, so once it's been clinically diagnosed, okay, the next is treatment part. The treatment part, then again, the first and foremost is staging of the disease or staging of the stomach cancer. The staging is also clinical staging and pathological staging. Clinical means before the surgery, the clinician makes, okay, this could be the stage of the disease, like it's limited to the stomach, it's gone to the lymph node, nearest lymph nodes or draining lymph nodes, or it's gone to the liver, it's gone to the lungs. So accordingly they will decide. Pathological staging is once we remove the specimen, they will look for the lymph nodes and the perivascular invasion. So many things are there. Type of cancer, severity, the grade of the cancer, all these things will decide the stage of the cancer. Usually the usually the staging is dependent on TNM classification. T stands for tumor size, the size of the tumor. N stands for the lymph nodes. It's only the perigastric lymph nodes, or it's gone to the celiac lymph nodes, or gone to the other lymph nodes. So that's called nodal metastasis. M is metastasis. It's gone to the liver or gone to the lungs. So usually TNM is the classification and staging of the stomach cancer. Okay, what is the treatment? So like any other cancer, if a cancer can be seen or can be diagnosed with radiological findings, is always surgery is the first and foremost is the surgery. Just because of it's eligible surgery, that doesn't mean we do the surgery. Again, it depends upon stage of the disease. Suppose somebody is having a stage 4, or the staging depends upon stage 0 to stage 4. There's 5 stages. Stage 0 is called you cannot see in situ. You cannot see usually. It needs special things to look into that. So that is a very earliest cancer. Stage 4 is a distant metastasis. So earlier the cancer, the good response or the good treatment or good recovery or complete treatment. The higher the stage, the poor prognosis. This is this thing. Okay. Just because of somebody can be operated, but if it is a stage 4, then usually surgery is not advised usually. Suppose somebody is having stage 1 or 2, but it's really sitting on the major organs. Like suppose you have a stomach, behind there you have abdominal aorta, and it's stuck to that, and you cannot do surgery. Then it comes under category of inoperable. So stage decides the prognosis and treatment options, and in the treatment first and foremost is the surgery, and surgery is whether it's operable or inoperable. Once the surgery is over, then it comes chemotherapy. So chemotherapy, the surgery removes the whole cancer, visible cancer, everything is removed. Then chemotherapy is for, suppose the cancer spread without through the blood, it gone to the other structures. To kill that, to destroy that, use the chemotherapy, whether it's an injection, tablet, so many things are there. Then radiotherapy. Radiotherapy is not for all cancers, only for selected cancers, where it is for local recurrence, like lymphatic spread, we call that. So for that, radiotherapy. So that is decided after the surgery, decided mostly by the medical gastroenterologist. And if suppose the tumor is huge, even before the surgery, there is something called neoadjuvant chemotherapy. That means they will give the chemotherapy. When they take a biopsy to the endoscope, we know what is the type of cancer. So along that kind of chemotherapy will be given 2 to 3 cycles. Will shrink the cancer tumor size and make it operable or make it easy to operate, and that prevents cancer spread during the surgery. So these are the latest one, the neoadjuvant chemotherapy. Once the specimen is out, sent for biopsy, complete pathological staging, then radiotherapy or chemotherapy or radiotherapy is given. Okay, so how to prevent next? Okay, suppose how to prevent. So again, we always say there are modifiable factors in See, if you have a gene related thing, that we cannot do anything at all. But what we can usually just have avoid salted, pickled or preserved or stored food. Any stored food, pickled or maybe salted all these things should be, or cooking, directly putting into the fire, like what do you call it, barbecue, whether it's a vegetarian or non-vegetarian, but directly into the fire, that kind of cooking should be avoided, first and foremost. Second, avoid smoking and alcohol. Third, increase your vegetables and fruits. These are the main things. And if you are around 40 years and if you have a family history, or even if you are around 40 years and you have a weight loss, loss of appetite, blood in the motion or black color motion, and unexplained tiredness, all these things, kindly get a advice from your doctor. So most of the people, again, they will ask, suppose I have a cancer and whether my children will get. So these things, how to, we always say, how to prevent passing the cancer to the other generation is, we always say, don't get married within the your community. So that's the only way we can prevent the progeny or the next generation getting into that. Thank you.